Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert here, and I want to say that I am happy to have my co-host today, Dr. Millicent Ravello, who will keep the discussion going in a very positive and very informative and non-judgmental direction.
Always.
Yes?
Although, I don't know if I can do that today.
I'm not sure you can.
Because I've been in this really spicy mood all afternoon where it doesn't take much to set me on a tangent today. And I don't know what that's about. I think maybe I got some sleep last night. Maybe I had too much caffeine, but I have opinions today. I'm very vocal about them.
Yes.
So maybe this is a good time to do a podcast.
I always have opinions.
Well, that's true.
And you always have opinions. You're just better at sometimes. You're good at taking the opinion, getting it ready, putting makeup on it, and brushing its hair, dressing it appropriately, and then presenting it for the flogging. I just begin the flogging right away. I get right into it.
That is a very nice metaphor. And it's probably going to ring true today.
Yes.
Because today we are talking about breast implant removal, otherwise known as an explant. So an implant is when you put something inside the body. An explant is when you remove it. Kind of like when you show your ex the door. An explant. GTFO. But no, really, it's about explants. And because we've been talking about this recently, we've had opinions we've been voicing to each other, because there are a lot of truths and there are a lot of myths about what actually happens when that implant comes out of your body.
Yeah, this has become a common trend in plastic surgery where a lot of women want to have their breast implants removed. We don't need to get into the reasons why.
Well, we can touch on them.
We can touch on them.
Because there are lots of
we can touch on them.
We're going to touch on them. We're not going to massage them.
No,
we're just going to touch on them.
We are not going to present them for the flogging just yet.
Yeah.
We will do a 101 when we're ready. We're not ready. Explant surgery, just taking the implants out for any reason. And those reasons can be related to any of the above. Number one, you're just tired of them. They were great for a time and a season, and you're over them and you want them out. You want to have smaller, natural looking breasts. That's one reason. Number two, you have had complications from implants, including, infection, recurrent capsular contracture, just overall pain and discomfort. These are all reasons why patients choose to have implants out. The last one would be BII, breast implant illness, where you feel like the implants are making you have systemic symptoms, fatigue, rashes, etc., things that can't be explained, and you think maybe they're related to your implants. All of the above are reasons patients may want to have their implants out. For sure. And the most common in my practice are recurrent capsules where people they've just had it, they want them out, and BII, the breast implant illness. Patients come in, they say, I think my implants are making me sick. I had this test, I had that test. I want them out. Hopefully I'll get better. And they've done enough of the reading on the internet to hear other people's stories, and some people have gotten better, some people haven't. My answer always is, these implants were placed electively, and they may be removed electively. So whatever you want to do, that's fine. We'll do a capsulectomy, send it for all the things that you want to send, check it and see if there's bacterial contamination, et cetera, et cetera. But in the end, some patients I've seen get better with they had symptoms and their symptoms were gone. And if you look, there's a whole big video on YouTube about this one patient, Chelsea Penner, that I took care of, and I can name names because she's got it up on the YouTube channel and she's very vocal about it.
You're talking about BII.
About BII,
yeah.
And she got better.
Which, by the way, for the uninitiated, breast implant illness, these are patients that have had implants in place and believe that they're causing systemic symptoms not explained by any other medical phenomena.
Right, which, again, I have always said this, and I'll say it again today. Somebody is sick from their implants. Somebody is sick from their implants. I don't know how many people it is. I suspect that a lot of people who get their implants out and don't have their symptoms get better feel that it wasn't their implants that was causing their illness, which is a lot.
Which is possible.
And there's a lot that do get better. So